Hey Facebook family, it's Tisha Rowe. I am here today to talk about coronavirus. Many of you who know me and follow me know that I am a family medicine physician practicing in Houston, Texas, and the founder of Rodox, a telemedicine company specializing in care for busy professionals, busy families, and the uninsured. So, since the coronavirus outbreak, naturally, I have gotten a lot of information, both from colleagues, I've gotten questions from friends, from patients, and there are a lot of different resources out there. I did not come on today to hash out every detail of the coronavirus. It's new to you, it's new to us as medical professionals, and the information is being updated in real time. One of our primary resources, the American Medical Association, has created a website for healthcare professionals that allows us to find information and decide what to do. So I'm going to post in this live links that have been sent to me that I think will be helpful for you. And please feel free to ask any questions you have in the comments, whether you're watching this live or as the replay. If I don't know the answer right now, I promise to research and find the answer for you. From what I have gathered so far, the coronavirus symptoms are very similar to symptoms of the flu. So if you see, if it seems that healthcare professionals are not as anxious or worried about it as it appears in the news, it may be because we understand how deadly the flu is, and we've seen the amount of deaths from the flu. So it's interesting to see the media attention being given to coronavirus, which I think is very valid and justified, but without really comparing it and putting into perspective for people to say, well, here is the coronavirus with, less than 100 cases from what I've seen in the United States, whereas I believe this year alone, we've already had thousands of deaths from the flu. So the chances of you coming in contact with coronavirus versus the flu is it's much more likely you will come into contact with the flu. So I am a primary care physician. I encourage people to get the flu shot. Every year, many of my patients, I won't say most, but a lot of my patients turn down the flu shot. So if you are anxious about the coronavirus because it's a virus that could potentially kill you, my first advice has nothing to do with corona but go get your flu shot, because you're much more likely to get the flu, and we know for sure that the flu can kill you, right? So while you're panicking, wearing these masks and, doing all these other things, isolating yourself because you're afraid of coronavirus, I wish we had the same kind of enthusiasm protecting ourselves from the flu, right? And as far as I know, there's no vaccine for coronavirus. So if you come into contact with it, good luck, right? But the symptoms of the coronavirus, which I am right now on the CDC website, making sure that I'm giving information, facts directly from the Center for Disease Control. That is what I would recommend. If you're on Twitter, follow the Center CDC on Twitter. Turn on notifications for the CDC. Subscribe to the CDC newsletter, and that will be the most reliable. Don't trust the news. Not saying you can't trust the news, but we know sometimes you can't. But that's not Google. Go to the CDC. They hire teams. They've dealt with multiple outbreaks. It's where I'm going to go to find information if you ask me a question. So here on the CDC website, I'm reading from the website. This isn't my novel information. Symptoms appear 2 to 14 days after exposure. That includes fever, cough, shortness of breath. When I was doing urgent care, that would be most of my patients. Not everyone has shortness of breath, but many people who have strep throat, bronchitis, any upper respiratory issue can have any of these symptoms. So it's really going to come down to other risk factors. Have you traveled? Is there a chance you could be exposed? And the truth of the matter is, even if you didn't travel, you don't know who may have traveled that could be then transferring it to you. Okay. But if you have any of those symptoms, again, I'm going back to the CDC website. It is the CDC recommendation. I don't want to read this directly from the CDC website. For health professionals, if you have a person that you suspect has coronavirus or COVID-19 as they're calling it. Hold on. Healthcare professionals. Let's see here where it says examining people for investigation. Make every effort to interview the person by telephone, text, or video. You all know, I'm sorry, I have a little tickle in my throat and I don't have any water nearby. Oh, actually I do. Look at God. You all know that I have a telemedicine company. This is from the CDC. Make every effort to interview by telephone, text, or video conference. If you think you have symptoms of the coronavirus, do not go to the emergency room. God forbid you actually have it. What are the chances of you spreading it to someone else sitting in a crowded emergency room for hours? Because if you're not bleeding or dying, trust, just having a cough is not going to get you expedited because you think you have coronavirus. They know that more than likely you don't. You're going to sit there for hours. Or you went there thinking you had it, you don't have it, but little did you know the person 2 or 3 seats over from you actually has it, and now you have gotten it by sitting in that busy urgent care or busy ER. So there has never been a better case or a better time to consider seeing a doctor virtually than now because of this. This is on the CDC. I'm going to post this link. Make every effort to interview by telephone, text monitoring, or video conference. If your health professional, physician is not offering you that option, that's a problem. And you may need to consider seeing someone else if they're requiring you to come in to be evaluated for these symptoms. So let's say they interview you, you actually were crazy enough to travel somewhere where there's been an outbreak in the last 2 to 12 days before your symptoms started. And now you have these symptoms of the coronavirus. You see this doctor, whether online or face-to-face. What is the next steps? So despite all the links and all the articles I've gotten, I'm like, okay, what now? Now, granted, I have not seen a patient that I suspect has the coronavirus yet, but I am not going to wait until that time comes to figure out the next steps. It is my responsibility as a healthcare provider to figure out the next steps now. So what do? I go to the CDC and I try to figure out what to do. The CDC says if you suspect that you have a patient with coronavirus, to contact your local healthcare professionals, your local healthcare health department. Now, before I saw that this morning, I contacted the lab I usually use for my patients to say, do you all have the kits to test for coronavirus? They said, no, contact the CDC. I called the CDC. CDC took 2 hours to call me back. Now imagine if there was a patient sitting in my waiting room and I had not done this ahead of time. And let's assume this person is positive, right? So 2 hours before I got a call back from the CDC, that person would have been sitting, whether in a patient room or wherever, in my office, right? I finally get a call back. The CDC says, call your health department. I said, well, give me the number to call. They gave me the number to the Texas Health Department. I called the Texas Health Department. They say, call the Harris County Health Department. I called the Harris County Department. They refer me back to the Texas Health Department. I call the Texas Health Department. They refer me back to Harris County. At that point, she tells me, call the health department. And I say, no. I said, if I had a patient, what would you do? And that's the point where she says, well, wait for it, have to call the CDC. So she is going to go back right where I started. I know, Dr. Matthews, I'm sideways. I'm sorry. So I'm just going to explain. When I upload this to YouTube, it will be corrected. But when I'm doing it on Facebook, to have the right frame, I'm sideways. I don't know why Facebook doesn't allow you to record horizontally, but if I do it the other way, I have like this much space above my head, and I don't like that. So sorry, bear with me. But okay, so after all of that calling, she says, I have to call the CDC. The first person I called. It literally was 4 hours from the point where I first called the CDC to speaking to someone in my local health department who then only told me she was going to call the CDC. So these are the inefficiencies in the healthcare system where we need to have task force set up for issues like this so that not if, but when it comes to Houston, right? You don't operate as if, well, let's cross our fingers and hope it doesn't happen. When it comes to Houston, patients know exactly where to go. Physicians know exactly what to do without spending 5 hours doing what I did today. And then there won't be mass hysteria. So this is my recommendation to you. If you have the symptoms I described earlier in the video, the first step is to contact your doctor and request a virtual appointment and let them know, I want to be seen virtually because that is the recommendation of the CDC. Do not go in, okay? Second, if your doctor says no, go to rodox.com. We will find a doctor who will see you virtually. Third, if you don't have a doctor, just go to rodox.com. If that doctor suspects that you have symptoms, they need to call the local health department. That number can be found through a locator on the CDC website. There is a form that the CDC will have them fill out called Human Infection with 2019 Novel Coronavirus Person Under Investigation and Case Report Form. The CDC is then supposed to give that doctor directions for specimen collection. Those directions have been emailed to me by my local department because I told them I will be screening patients and I need it sent to me in advance. The CDC gives them the protocol for collection and then should arrange for that specimen to be taken to the local health department for it to be confirmed. After that, they're going to have a whole protocol for isolation. Your doctor, if you do see them in person, should be wearing protective equipment. If your doctor does home visits, same thing. They should be wearing protective equipment. That protective equipment should be disposed of outside the home. So there's a lot in there that isn't as easy to find as they're making it. Like, just go to the CDC website. It took me 5 phone calls, 4 hours to figure out exactly how to make sure that not if, but if I have a patient, what I would need to do as a medical provider. If you're watching this and you think this will be helpful for healthcare professionals that you know or anyone that you know that may be worried, afraid of these symptoms, please feel free to share this video. In general, you have no symptoms. What do I recommend? I saw a great post from an infectious disease doctor, which I I agree with, and I'll share her link to her blog as well. You know, all of the extra mask, all of that, very unlikely that it's going to be effective in helping you at this time. Good hand washing, avoid crowded environments, avoid unnecessary travel, avoid crowded waiting rooms with sick people. That's the only thing I'm doing for my family. That's what I recommend you do for yours. I hope that this has helped you a little in terms of figuring out if you have to deal with this problem, what your next steps should be, and how to handle it. I pray for anyone that is in an area worldwide that might be heavily impacted by the virus, and I pray that it doesn't come to your area where you may be living now or where I live. But the fact of the matter is it can happen, and we all need to be prepared and cautious and leverage technology to our advantage to minimize the impact of this global issue. Telemedicine is one of the best ways that we can minimize the impact of the coronavirus. It's a time for us to embrace it. Having a company that has a local presence, not just random online doctors that you can't go into an office and see, is your best bet. So any questions, post in the comments. If you found this helpful, don't be stingy. Don't keep it to yourself. Share, share, share. And if you have any additional questions, please feel free to post, and I'll be happy to respond later. Look out for the links and in the comments as well. Thank you all for joining me for Rodox Wellness Wednesday, and I look forward to seeing you next week. Let me know what topics you want to hear, and I look forward to sharing with you then. Talk to you soon. Bye-bye. And you can follow Rodox on all platforms at ROWEDOCS.com or our handle at Rodox. See you soon.